state of Connecticut, and on July 1st, 2 months ago, the number of people hospitalized was 37. So we're getting increasingly concerned, and obviously almost 100% of these cases are the Delta variant in New Haven. Our positivity rate in New Haven as of Monday was 2.4%. CDC continues to classify New Haven as an area of high community transmission. We are making some progress on vaccinations, and it is clear that if you get vaccinated, you are much more protected from getting COVID-19 and getting severe COVID-19. There's been some new data from the Connecticut Department of Health on breakthrough cases that indicates that unvaccinated people are 5 times more likely than vaccinated people to contract COVID-19. If you don't get the vaccine, you're 5 times more likely to get COVID-19. And 16 times more likely to be hospitalized. So if you have not been vaccinated, get vaccinated. The risk is too great to avoid getting vaccinated. Our health department, in partnership with Griffin Hospital and other partners in the city, has hosted over 430 pop-up clinics so far. I mean, that number is astounding. It could not be easier in New Haven to get vaccinated. Ongoing clinics on the Green and weekends at Longworth are some of the ones that we're doing around the city. As of Monday, 68.7% of individuals 12 years old and older have received at least 1 vaccine dose. So we're making progress. We're almost at 69% of eligible residents have received at least one dose. We, in particular, over the last several weeks, have seen a big jump among the 12 to 17 age group. 46% now have received the first dose. Clearly, we have more work to do there, like many places, but we're making progress. As far as masking goes, we instituted a mask mandate, as folks know, on August 8th. And while many individuals and businesses have complied, there's still some problems. Our health department and economic development department have gone to an incredible number of businesses around the city, downtown, and the neighborhoods, to do outreach, to notify business owners, to ensure that they have the resources that they need, the tools they need to make sure that their customers are wearing masks. And because we're continuing to see some violations, our health department is conducting enforcement visits with our COVID-19 inspection team, which also includes the building department and the fire department. Thank you for being here and for your work. Businesses can face fines and potentially be shut down if they do not abide by the mask policy. Just to be clear, the evidence that masks help prevent the spread of COVID-19 is overwhelmingly clear. It is overwhelmingly clear. I've received 1 or 2 emails from people that cite a couple of studies that say that masks are not effective. The overwhelming majority of studies indicate that masks are very, very effective. The science indicates that masks are effective. People need to wear their masks. Just wanted to give one final update on the city's vaccine mandate. We had a press conference last week about, for municipal employees, the requirement that employees either get vaccinated or get weekly tests. Couple updates. The employees are going to be they will shortly receive the policy, the details of the policy and the requirements that are upon them to get vaccinated and upload that vaccination information or get tested. The policy technically goes into effect on the 27th of September. Employees will be required to upload to our COVID-19 vaccination portal between September 7th and 14th. Their either proof of vaccination status or that they're choosing to opt into testing instead. And then starting the week of the 27th, employees will need to get tested weekly if they do not choose to get vaccinated. Testing will be generally done and allowed on work time for employees. And we are working with the unions and having productive conversations with the unions about facilitating that. Employees who are out of compliance with the policy, managers will be notified. And after which point, employees will have 24 hours to correct the situation by either getting tested or uploading their vaccination information. And if they do not do that, employees will be deemed unable to work and will be put on unpaid leave. I'm going to hand it over to Dr. Bond.
Good morning. So to just sort of complement what the mayor indicated in regards to giving you a landscape of what's happening statewide, locally, what we're seeing the beginning of July, where we were seeing about approximately 14 cases per week, we are now today seeing over 200 cases per week. So just to paint the picture, as we indicated, we are in high-risk transmission. One of the things that that's sort of trending is that people are saying we've reached the peak. I'm going to advise the community to know and understand that it is unknown whether we reached the peak. What we do know is that there are a lot of indoor activities that are increasing. We just had colleges that just started, as well as schools have reopened. And so we have no certainty of whether or not we have peaked the surge that we are in. From the beginning of the pandemic, we had fatalities, and we know that I had mentioned previously that we were very fortunate that we did not have any fatalities. I am sad to report that we have 2 additional deaths added to the total of COVID fatalities due to COVID. So it's really critical that we continue to emphasize the importance about mask prevention, hand hygiene, social distancing. And while I do promote being social, we need to be socially responsible as well. I am excited to be alongside with my COVID task force team. Unfortunately, we will be activating and transitioning into the enforcement mode. We spent about 3 weeks doing the education, notifying all of the establishments, working with the local business of commerce to ensure that businesses were notified properly and given also posters and even mask distributions so that we can support reopening. While we do support reopening, we will not tolerate individuals that disregard the lives of the larger population that we serve. It is a tough position that I'm in, as well as the city as a whole, when we're responding to a pandemic, because we have to think about the health and well-being of the overall population that we serve. And the small percentage of individuals that continue to not comply will have to adhere to the protocols that we have in place. And so what are those protocols? We have a 3-tier system protocol within the health department and COVID-19 response team. We issue verbal, which is a verbal, we'll meet with you, we'll come to the site when the complaints come in, or if we witness it when we're on site conducting routine inspections. To date, we've issued we've instituted 28 verbal warnings. We have transitioned to 2 written warnings, which is the 2nd tier, and the 3rd tier is the shutdown. What we're adding currently today, as we're activating into full enforcement, is that we will also issue infractions of $100. But what's important to know is that with the first pandemic, we did not take this lightly. As we know, and it's been reported, we had to unfortunately close over 13 establishments in total in the first wave of the pandemic because of the continuous violations that businesses did not adhere to. It was a combination of the governor's orders at that time. So our goal again is to ensure to institute verbal warnings for businesses that have not received them. When we start going on site, if you received a verbal warning, you will be transitioning into the 2nd tier. And so we will be activating as a task force collectively because we've also received complaints about capacity limitations. There are capacities for businesses that are licensed in the city of New Haven, and there are some settings where we have been seeing concerns about egress issues. And so we will make sure that we're also assessing for that and looking at your capacity, normal capacity limits, and ensuring that you're not exceeding those capacity limits when you are operating in your establishments. Also, what I wanted to close off and indicate is that we will be starting well, they're already out every day, but tomorrow formally with the task force, tomorrow morning we will be going out to establishments to institute such. And so with that, I'll turn it over to, does my team have anything to add? No. We're going to open it up for any questions that people may have.
I'd love to ask a bit more about what you're looking for when you go to businesses.
Oh.
If I understand this correctly, there's a mask mandate, but there's no special social distancing or capacity order related to the pandemic. It sounds like there may be normal capacity.
Just normal capacities, right? So when
what
you're
is it
licensed,
what is it you're looking for?
so what we're looking for is compliance of the executive order that was instituted. So if you're in indoor public facilities or establishments, you need to be wearing a mask when not eating or drinking. If you're entering the business and you're going into the business, you should have your mask on when entering a business. And so it's really critical that even if you're waiting in line and there is no possibility of social distancing, you keep that in mind because you're going into a business. And so we're expecting mask compliance. We are also expecting proper signage. So we want to make sure that you have proper signage. We will have an abundance of supply of signage with us and we've been doing that already for the last 3 weeks. But you should have proper signage that mask use is going to be required. What I want to emphasize, and I know it's difficult because it's inconsistent throughout the state. So those individuals that are visiting from out of New Haven and are not residents of New Haven, it is vital that you are aware of the mandate in the city of New Haven. We welcome you to certainly partake in the activities that are happening in our city or to frequent a restaurant or establishment, but we ask that you adhere and comply to the executive order that we have in place.
And these $100 infractions, they're related only to compliance with the mask
Correct.
mandate? And is that $100 per venue or
It will be
person,
per venue, and then again emphasizing the 3-tier system of verbal, written, and shutdown.
Mr. Bond, what type of businesses are you hearing issues with? Is it run the whole stretch? Or
It's a combination of restaurants, delis, fast food establishments, definitely the nightlife nightclubs, and so it's been a combination of all, believe it or not.
How do you police nightclubs and such? Because you've got a bunch of people packed in there. Some might be dancing. Some might be standing the row behind the bar with a drink in their hand or something, or without a drink. How do you handle
Business
that?
owners are responsible for policing their establishments. If we want to keep safe, we need to make sure that we are adhering to the executive order. So it is the responsibility of the business owner to comply with that.
I have a question maybe for the fire marshal or the building official about what role you see your departments playing or you as individuals playing in enforcing COVID-related safety on these inspections? Or do you think that this is more general building safety? Because now, I mean, the mask order seems, a little more limited than the earlier stages of the pandemic.
Sure, I think so. What happens is from being in these different occupancies throughout the building, regardless if it's an assembly, like I said, a restaurant or nightclub, we work in conjunction with the other agencies. So with the building department, with the health department. And just because we're familiar with these properties, if we go in there and we find some kind of imminent hazard or blocked egress, usually we'll mitigate that as soon as possible. If anyone in the community needs assistance as far as if they're not sure about their occupant load, that's something they should have and have posted in their establishments. If they don't and they want to recalculate that or have someone come out, the fire marshal's office could set up an inspection, come out, and we'll do the measurements to calculate their occupant load. So we're just there to assist the community. Everyone's been doing a great job overall. We're just trying to make sure we keep the community, those that live here, work here, and visit here, safe. So, thank you.
Thank you. It's 100 per incident after the written warning. After the written warning.
So my understanding, Director Bond can correct me if I'm wrong, it's $100 per incident means if there are multiple people wearing masks, we could actually fine more than $100 for that one visit. We don't want to get businesses in trouble. We don't want to fine businesses. We don't want to shut down businesses. And ultimately, we ended up having to do that after we worked very hard to warn businesses many times and support them doing the right thing. So our goal is to support businesses doing the right thing here, and that's why I would call it almost a 4-tiered system, because we spent the last 3 weeks engaging with businesses around the city, making sure that, I've stood in front of you all saying, we don't want to enforce. At this point, we don't plan to enforce. We hope that businesses and expect that businesses follow these rules. It's not happening, so we're going to start to ratchet things up a bit.
So we received about 28 in the last 3 weeks associated, and they all varied from different type of sectors.
I guess my last question is about some of the numbers the mayor shared about, so around over 68% of eligible New Haveners have gotten at least one dose.
Yeah.
Do you have an actual, like, how many people is that? Do you know what the 68% of eligible
So we
is?
have about
And then how
70,
many people are fully vaccinated?
61.7% are fully vaccinated over the age of 12. And then I believe I actually did have the number. So we have about 70,000 residents vaccinated. And then, and so that's an average, about an estimate, yeah, about 70,000
That's 70,000 fully vaccinated or just first
fully
dose?
vaccinated.
Thank you.
I know you guys are taking the initiative to go ahead and do this executive order. You mentioned, people coming into New Haven, it's consistent around the state, so they might not know what the rules are. Would you prefer that the state, the governor, issue a statewide mandate so municipalities don't have to shoulder that burden?
I think throughout the pandemic, it's generally been a better strategy when we all do things together. At the same time, I think the governor's weighing a bunch of different issues when he's making this decision. I keep thinking about what if we were Florida or many of the other states where the governors are actively undermining local communities being able to protect their communities from the pandemic. And I think the governor's done a very good job at supporting us and accomplishing what we want to accomplish.
And what do you have to tell businesses who maybe they want to enforce, but there's a lot of resistance out there to wearing masks indoors among their customers, and so their businesses are obviously juggling a lot in terms of not upsetting people, not dealing with people getting unruly, but now going to have to move forward and enforce this.
Yeah, I mean, it's tough on everyone, right? But I think that one of the reasons that we heard from the business community before we implemented this mask mandate, because we talked with a number of representatives from the business community, is that it's actually helpful for the city to do this mandate so they can say, hey, look, it's not us. We don't want to get fined. We don't want to get shut down. You got to put on the mask, and I'm sorry. Even if I don't agree with it as a business owner, you got to do it because the city's telling you you have to do it. I'm happy to be the bad guy here. This is the right thing to keep our residents safe, and we're trying to support the businesses and give them the tools to do so.
And I just want to add, I think one way that we're doing that, and even when we start going out as a task force, we're going to go out with multiple boxes to continue to support businesses. Because obviously there are a lot of businesses, and I frequent a lot of businesses as a resident because I like to support local business. They are in compliance, right? So it's a smaller percentage of businesses that are not adhering or are struggling with complying and being clear. And so hopefully we're clear, and then we'll also be providing boxes of masks so that they can be able to, those that may frequent from out of town can at least get a mask if they do not have one.
And I just want to revisit tonight's question really quick about the nightlife, and because obviously the students are back, things are picking up downtown. But we saw it with Bar when they did their vaccine mandate because they didn't think that they could properly monitor people wearing masks when they were dancing close together. So what can you offer to those businesses in nightlife that's hard? If you have people dancing together, there's not really any social distancing going on, and it's hard to make sure people are wearing those masks, and it's hot.
And it's hard for us when we're seeing our positive cases continue to rise. And so it's going to be important that for us collectively to work together. So I encourage nightclub owners to work with the sanitarians and our task force team so we can strategize on the best way. And so if you do not want to be in a crowded space, perhaps they need to consider assessing their capacity, right? So they need to consider a number of factors. We know the different mitigation strategies that work, and so businesses need to be thinking strategically on how to remain open safely.
So if you're someone who's coming to a bar downtown, you've got to know if you're going to dance, you got to wear a mask.
If you're not drinking or eating.
Yeah?
Indoors.
And we've said this over and over and over again. The goal is that we're done with this thing so businesses can operate fully. And if we have a little bit more pain now, it's much more likely that we're all going to have a health as a community, and that will allow the businesses to properly operate and make more money. We've got to get this thing under control. We would be in a much different place if cases were low, right? We would not have the need to implement some of these restrictions. And so the sooner we can get cases low, the sooner businesses can open up and have much more freedom to make money.
Director Bond, on the 2 additional COVID-related deaths, can you talk about ages, gender?
I do not have the details right now because we also like to make sure that we verify with our vital statistics office. So we just caution not to share any information, but we did get notified that there were 2 fatalities.
Do we know how many people in New Haven have died as a result of COVID?
In total, since the pandemic started,
Yes, please.
it's 211.
211?
Mm-hmm.
Including the most recent two?
Correct.
Okay.
Director Bond, you mentioned last week 1 pediatric case. Where do we stand with the pediatric cases now?
Right now, I don't have an update on that, but I can find out.
Thank you.
Thank
very
you.
much. Mr.
Good morning.
Morning.
Good to see you.
Mr. Mayor, I apologize. We were having microphone issues while you were talking. Would you mind summing, just while you were talking? Okay, you were talking at the beginning about...
That's nice.
For the record,
You tried to get, I saw that, you tried to get there.
so you talked about increasing cases,